Hello, my name is Najimo Akanji. I'm a mental health nurse practitioner student. I'm with my preceptor in person of Dr. Pius Atu, a mental health practitioner here in Sana Health Group. So I'm just going to give you a little background of what we've covered for the last 5 weeks. I was privileged to have Dr. Pius Atu as my preceptor. In the first week of the clinical rotation, I was kind of nervous about what is going to be my experience. But with confidence and hope instilled on me by my preceptor, things have been moving well. I was able to learn how to participate in assessment of mental health disorder patients, people with schizophrenia, bipolar disorder, and she was able to show me what are the appropriate treatment regimen or medication that could be ordered for those people in order to promote their safety and to ensure that they comply with their medication regimen. So this is my preceptor, Dr. Pius.
To whom you may concern, my name is Pius Atu. Again, I would say privileged and happy to have Mr. Kani, with me as a student on all circumstances. When you have new learners, there's tendencies of, being nervous, but he has overcome that, within a space of time. We've come a long way, and I could see confidence building in him. And he has been able, to perform, certain roles and assignment given to him. He's very proficient now in assessing patients. Try, as much as possible to formulate diagnosis in terms of how we go into history and coordinate effective assessment. At this point, we're working on him to get proper diagnosis out and how medications are applied towards those diagnoses. He's working on it, and I see him progressively coming up, and I would say he has done excellently well.
Yeah, thank you, doctor. I could remember when I first came, and we assess a patient with substance abuse. He came in very drowsy, groggy, and he
Yes.
told me that we cannot give such a patient benzo right away. And he told me that we need to do the assessment because I was asking you that how come we didn't give this patient benzodiazepine right away. Then you told me that we have to get the thorough medical history. So I learned one thing that day that before you can even prescribe a medicine to the patient, you cannot just obtain a psychiatric history. You still have to obtain a medical history to make sure that no medical problem are not the reason why the patient is being psychotic or anything like that. So then my preceptor let me realize that regardless of the patient age, gender, and settings, you still have to treat them with respect, and you cannot judge them based on what they come in for. You just have to make sure you treat them with respect and you provide a quality patient care to them. So another thing that I learned during this process was that when the patients come in, you still have to greet them, introduce yourself, let them know your roles and how you're going to help them. And my preceptor let me realize that you can't just base information based on what the patient tells you. You have to use your own clinical experience to gather much information about the patient based on their appearance, judgment, and their thought process. So most things like that, I was able to apply those things because they gave me an opportunity to participate in assessment of patient with bipolar disorder. The patient came in, she was very manicky, yelling, screaming. So instead of us to get argument with the patient, preceptor said, no, you have to calm down. You don't get in confrontation with them. You have to calm down, ask them how you can help them. Those things, and the patient calmed. Initially, it was very argumentative, but when the preceptor talked to him, he was able to calm down. Then he described the reason why he was acting like that, and appropriate medication was given to him. I think we give him a lithium that day.
Yeah, we started him on lithium.
We started him on lithium, and we do the lab.
The lab, actually, have to check levels.
Okay, yeah.
So see, how, because when he came in, it was indicated that he was on lithium. So in order to continue that medication, though he didn't take the medication for quite some time, we wanted to see the level, and we ordered lab and continued on that medication.
Okay, so that day I learned new thing that before you start patient on lithium, you have to obtain the lithium level, and you have to do the CBC and lipid panel, something like
panel,
that.
right.
Oh, lipid panel, that's what we heard that day. So my experience so far has been a very productive one, and I've gained a lot of experience. Hopefully for the next 2 weeks we'll learn something different.
Absolutely.
Yeah. Okay. So then another thing is, I remember you advised me that I should be, regardless of before the patient comes in, I must make sure that I review their chart before they come in. In that case, I will have a better idea of what they come in for and how to.
Very, very, very important. The reason why I told you that is that you have some patients who are very poor historians, and some of them don't know how to really, give you the insight of what is really going on with them. So it's important for you to review, medical histories. If you have the time to review it, so you have a very good compound knowledge of what is at hand. So the time you come and you're doing your interview questions, you're able to pull out certain things from the patient. So that's why that is important.
Okay, thank you, sir. Thank you.
All
right. Nice working with you. So I will see you next week again.
Yes.
Thank you, sir.
All right.
Bye bye.
Thank you.
Thank you.